Hello everyone and welcome back to the series on self-help acupressure. One important question being asked these days is that can acupressure help in boosting our immune system? Well, I would say yes, because there is enough evidence that acupressure has been used to help in autoimmune disorders, allergic reactions, psoriasis, asthma, and similar diseases. Now, if acupressure helps in treating such diseases, then its usage as a preventive measure for boosting immunity is a distinct possibility. To help the body to combat against environmental antigens, we must energize the lungs, the gastrointestinal system, and skin-associated meridians, which are in constant exposure to the atmosphere and the items we eat. Some of the points to be described have already been elaborated upon in the earlier videos for other disorders. Nevertheless, I would repeat them as the usage is now for a different purpose. I have shown here the organ clock. According to the organ clock theory, each of the 12 meridians has a period of maximal activity. Thus, each meridian is supposed to have 2 hours of peak activity in 24 hours. It is worthwhile to stimulate the channel 4 to 6 times on both sides during their peak period of 2-hour activity. This will help in boosting the channel more effectively. The 3 main points for boosting immunity lie on the lung, large intestine, and stomach meridians. Thus, the point on the lung channel should be stimulated between 3 to 5 am, point on the large intestine between 5 to 7 am, and the stomach between 7 to 9 am. Since the common viral infections use the respiratory system as the portal of entry, the respiratory system is energized by activating the lung meridian by stimulating the lung 7 point. The point LU7 on the lung meridian is about an inch above the transverse crease of the wrist on its lateral aspect. To locate LU7, cross the index finger and thumbs of both hands in an interlocking fashion. The point is located on the tip of the index finger. Li11 point on the large intestine meridian is located on the lateral side of the elbow. It is the tonification point of the meridian and is an excellent point for enhancing the immune system. It has been used for treating autoimmune disorders affecting cells of the ectodermal origin, such as the skin. Li11 point is very easy to locate. It is at the lateral end of the elbow crease when the elbow is semi-flexed. Stomach 36 point on the stomach meridian is on the anterolateral aspect of the leg. Apart from being the best homeostatic point for gastrointestinal disorders, it helps in enhancing immunity by stimulating the cells of the endodermal origin, such as the gut and thymus. Locating stomach 36 has been described in the video dealing with GI symptoms. Initially, one must locate stomach 35. With the knee flexed, lateral to the patellar tendon is the eye of the knee or stomach 35. 4 fingers below this and 1 finger breadth lateral to the anterior crest of the tibia is stomach 36. There are 3 paired meridians and 1 unpaired meridian that help in enhancing immunity. For boosting one's immunity, these 3 points, namely lung 7, large intestine 11, and stomach 36 points should be stimulated 4 to 5 times a day on both sides. Pressure by thrust for 30 seconds, followed by circular motion for 30 seconds is recommended on both sides. Large intestine 11 and stomach 36 could be massaged both sides simultaneously. Remember to massage the lung 7 between 3 to 5 am, large intestine 11 between 5 to 7 am, and stomach 36 between 7 and 9 am. The last point to be stimulated is governing vessel 14, or also known as DU14. This point lies on the midline channel on the back in between the spinous process of the vertebra of cervical 7 and thoracic 1 vertebra. C7 spine can easily be located as it is the most prominent vertebral spine on the back. DU14 lies just below this spinous process. Generally, one can do self-stimulation of the GV14 point. However, in case one has problems, then one should take the help of an assistant.